Yes, a very good afternoon to you all, student nurses and midwives. I want to take this opportunity to welcome students of Masaka School of Comprehensive Nursing, Kavale School of Comprehensive Nursing, Lila School of Comprehensive Nursing, and students from Lago School of Nursing and Midwifery. You're very welcome in today's lesson. With you is Zawe Dehawa, part of the blended learning team, and today we are here for a topic known as anthropometry. Yes, hopefully all of you are doing well and great, and hope you're ready for this session. Just be attentive. I believe by the end of this session you have gained a lot from it. So we are going to begin with our objectives for this session. And today's objectives, we are going to be looking at the definition of anthropometry. So I expect by the end of this session, a student to be able to define anthropometry, to identify the requirements for taking weight and height, to prepare the requirements for taking weight and height, and lastly to perform the procedure or to perform weight and height assessments. So you could be there wondering why I'm talking of anthropometry, and again you're seeing me talking of weight and height. So we are going to dive into the details of all that. So by definition, anthropometry, it is derived from the Greek words that is anthropos and metron. So the word anthropos in Greek simply means human. Then metron is measure, or any measurement is called metron. So that is where this word is derived from. Anthropometry, simply meaning the study and practice of taking systematic measurements of the human body. We are basically going to be looking at human measurements, okay? So it involves the measurement of human body's physical characteristics, for example, weight, height, body circumferences, and limb length, as we are going to see in our details. But we are going to basically be looking at human measurements. That's why you saw that in our objectives, I was talking of weight and height measurements or assessments. So that is simply all under anthropometry, okay? Hopefully we are now on the same page if I talk of the word anthropometry, isn't it? Right. So we are going to proceed, and they are telling us that anthropometric measures are sensitive indicators of the current nutritional status of an individual or a child, if at all you're dealing with a child, okay? Yes, so we are going to first look at the requirements that we might need. I'm going to be focusing more on weight and height for this session, but we shall be also looking at other measurements like the ones we've talked about, the weight, the mark, the the head circumferences, the limb length. We shall talk about them, but we are going to be diving in more for height and weight. So on our objectives, we had an objective of the requirements. We have to be knowing the requirements for use during these measurements. And one of the requirements that we use for taking weight and height, so now for weight, we shall need a weighing scale, okay? So we have different types of weighing scales depending on the age of an individual, okay? So these illustrations here that you're seeing, these are all weighing scales but of different types, and they cater for different edges, and they're not the only ones that we have. We have even some other weighing scales. So we have this one here, the first one. So this one is a weighing scale, but the different thing on, or the unique thing on it, it has what we call a measuring pole. So this one is self-contained. It can be used for taking weight. So a client stands on this board here, and it is able to display his or her weight at this gauge. Then it also has what we call a measuring pole, this one here. So this measuring pole, at the same time, it can be used to take the height of a client. So this one is 2-in-1. It can be used to take weight and height at the same time, if at all the client is able to stand. Then we also have this other category of weighing scale. So this one here, it is an electronic weighing scale. We shall appreciate it more when it comes to our practicals. We shall be seeing how we use these weighing scales and how we calibrate them, how we operate them, and all that. So this second illustration of a weighing scale, it is an electronic one. Electronic meaning that it uses power or batteries to operate. Okay, so this one uses batteries. When you lift it behind at its base, it has somewhere where you're supposed to put batteries in so that it is able to operate. Okay, and we also have this other weighing scale that you're seeing here in the corner. This one is a spring type. So for this weighing scale, it is used to take weight for babies, okay, for babies and who are able to at least sit. We don't use it to take weight of neonates and infants, but for babies who are at least 3 months and above. Okay, so this weighing scale is hung somewhere at a firm beam up. Then it has this hook here down where we place what we call a baby pant. So if we are going to take the weight of the baby, we put the baby in that baby pant, and then we put it on top of this hook after making sure that it is calibrated at 0, as we shall see in details as we proceed. Yes, so those are some of the types of weighing scales that we have, but we also have some other ones. For example, we have a baby pan. So a baby pan is used to take weight of infants. Okay, so I didn't put for you that illustration here, but I believe that you'll be seeing it when you go to your practical rooms. It will be there, that baby pan, and also to the hospitals, and also in our practicals, our online practicals, we shall be showing you that weighing scale. Okay, so in addition to a weighing scale, you also need what we call a stadiometer. So a stadiometer is used for taking height of a patient or of a client. So this illustration here is showing us how a stadiometer looks like. So we have this type, but we also have another wooden type. Okay, we shall appreciate it. We shall see that wooden type when we are in our practicals. So we have also a wooden stadiometer, and it is the common one, but we also have this one here. And this stadiometer is used for taking height, and it has a lurer, an adjustable lurer here up. Okay, yes. So we also have, we can also have a wall meter, a wall lurer. So a wall ruler is simply drawn on the wall. And if at all you're going to take the height of a patient, you make the patient stand closer to that lurer, a wall lurer, and then you have to be having a ruler where you're going to which you will put on the client's head to read out the results or his or her height at the wall. Okay. Yes, so next on the requirements, we shall also need a ruler and then a measuring tape. So the measuring tape is going to be used to measure, for example, the waist and also the hip and also the limb length, as we saw. So we shall be seeing how we use this tape measuring tape in details. And then lastly, we need what we call a record chart, where we are going to be recording all our findings after measurements, where you'll be recording the patient's height, the weight after measuring. Okay, so those are the requirements that we need for anthropometric measurements. So now we are going to proceed. So next we are going to look at the anthropometric parameters. I've already hinted on some of them, but the basic measurements, under the basic measurements we have the weight or a mass. Then we have the height is the length. Then we have the circumference. So this is when we are going to use our tape measure to measure the circumference. For example, the occipitofrontal circumference in infants up to 2 years only. So we cease measuring this. So the other basic measurement, we have what we call the skin fold thickness. Okay. So those are some of the basic measurements: weight, height, circumference, and skin fold thickness. So we also have derived measurements of the body compositions and interrelationships. For example, what we call the BMI, or we call it the BMI, body mass index, and also we have the waist hip ratio. So these ones are derived from the other basic ones that we shall be seeing. For example, the waist hip ratio is gotten by getting the waist measurement, and then we divide it by the hip circumference. So we get that ratio, which we call the waist hip ratio. And for the BMI, we shall see how we calculate it. Okay, so we also have some measurements. So for measurements that are used for nutrition assessments, they include, we use the weight or the mass, the height, and then the BMI. Okay, so for the BMI, to get the body mass index, we get your weight in kilograms, and we divide it by your height in meters squared. So that BMI will be in kilograms per meter squared. So we use these measurements when we are basically looking at nutritional assessment: the weight, the height, the BMI, then the triceps skin fold, and then we have the waist circumference, the hip circumference, then the mid upper arm circumference, and also the derived measurements and ratios, as we shall see in details. So now in this next part, we are going to be looking at the procedures in details. How do we take the weight? How do we take the height? How do we get the BMI? How do we measure the mark and all that? So we are going to start with height. How do we measure height or stature? Stature measurement technique. Okay. So what do you do? you as the assessor, you have to make sure that the subject or the person or the client that you're taking height, they must be barefooted, not on shoes, okay, and wearing a little clothing as possible, okay. Then the subject stands on a flat surface. Your client has to be standing on a flat surface at a right angle to the vertical board of the stadiometer, okay. Then his or her weight is distributed evenly over both feet, with the head positioned in a Frankfurt horizontal plane. So that is basically meaning that this client or the person you're taking height has to be facing forward. He or she has to be facing straight forward. That is the position we call the Frankfurt horizontal plane, okay. So in this position, the most inferior point of the left orbital margin is at the same horizontal level as the left trachea. That is the line of vision is approximately horizontal. So as I've told you in simple times, your client has to be facing straight forward as he's standing, and then the arms have to be hanging freely by the sides of the trunk, with the palms facing the thighs or downwards. Then you have to make sure that your subject places his or her heels together as they are standing. Heels have to be together with both the heels touching the base of the vertical board, that board you'll be using, or if at all you're using a wall ruler, the heels have to be in contact with the wall where that ruler is drawn. Or if you're using that stadiometer, the heels have to be touching the base of that vertical board. Then the medial borders of the feet are at about an angle of 60 degrees, okay. The feet have to be together, heels touching the board, and the medial borders at least should be about 60 degrees, not so apart. Then the scapule and the buttocks must also be in contact with the vertical board. What am I trying to mean? The scapule is the the bone behind the shoulders. So you have to make sure that the client's shoulders are touching the board or the wall, okay, and also the buttocks too. Then the subject must inhale deeply and maintain a fully erect position without altering the load on the heels. So as you're positioning your subject, you have to instruct them to inhale deeply to bring about that calmness, so that they maintain a fully erect position and not altering the load on their heels, okay. Then the movable headboard is brought onto the most superior point of the head with sufficient pressure to compress the hair. So if you're using a stadiometer, it has that movable headboard or a ruler. If at all you're using the wall ruler, you're supposed to be having an extra ruler. It is what you will use. You adjust it onto the superior point of the head and make some sufficient pressure to compress the hair. Then from there you can take your measurements to the nearest 1 millimeter, okay. So the measurement is taken to the nearest 1 millimeter. So that is for weight. But at the end of the session, I'll be showing you some videos to appreciate. So this is what we are trying to talk about: measurement of stature or height. 1. This person has to be standing erect. We say the hands have to be hanging freely with the palms facing downwards or facing on the thighs and facing downwards, as you can see. Then they have to be looking straight forward. Then the scapule or the behind of the shoulders have to be touching the board, as you can see this arrow here. Then also the buttocks have to be in close contact with the board or the wall, and also the occiput too. Then after positioning your client so well, let us have a view at the feet. So you're seeing the feet are together, not apart, and also the heels have to be touching the board. Okay. Then you bring your adjustable headboard. This one, you adjust it and you make sure that it is touching the superior part of the head of your client, and you compress a little bit on the hair. So this is the adjustable board. So same applies to this illustration, this image here. This is a service provider trying to take the height of this client, and she has positioned the client in the same manner we've been talking about: standing erect, looking forward, hands hanging freely, palms facing downwards, the buttocks and the scapule touching the board, and also the feet. Then the adjustable board compressing the client's hair in order for the service provider to read off her height. Okay, so that is that image. So next we are going to look at measurement of weight or mass. So this is the mass or weight measurement technique. What are you supposed to do? One, you have to be having your weighing scale, and then the subject should be barefooted still, okay, and wear as light clothing as possible. Remember, if this client is putting on heavy clothing, they are going to add on a certain weight on him or her, and you end up not getting the accurate result. So you have to make sure that the client is, if at all they are wearing some heavy clothing like the jackets, at least you first request them to remove them, and also jewelries, okay, because we have some heavy jewelries. So you make sure that the subject is barefooted and wearing as light clothing as possible. Then the subject stands on the platform of the scale with his or her weight distributed evenly on both feet. So you have to make sure that as you're instructing your client to stand on that weighing scale, make sure that they maintain an erect position still, and they stand firmly to make sure that their weight is evenly distributed on both their feet. Then the arms have to be hanging by the sides of the trunk with the palms facing the thighs. It is still the same position for height. So hands have to be hanging, and then the subject is instructed to maintain a stable position while the measurement is taken. So you have to always emphasize your client, so maintain a stable positioning. Take their weight after them stabilizing, okay? Not taking their weight as they are not yet stable. Then the measurement is taken to the nearest 0.1 kilogram. So you're having this illustration at the side showing a health worker taking weight of this client. The client is standing erect. Weight is evenly distributed on the feet. The client has stabilized their posture. Palms are hanging freely, okay, and they are on light clothing and barefooted. So from there you can read off their weight, the nearest 0.1 kilograms. Are we okay with that? Hopefully we are. So we are going to proceed. So that is measurement of weight. So let us look at how we can get the body mass index, or our BMI. So as I told you, the formula for BMI is if you want to get the body mass index, you get your mass or the weight in kilograms. So you're supposed to first measure the client's weight and height. Then after taking those measurements, you are now able to derive the BMI. So you get their weight or mass and you divide it by their height in meters squared. So this ratio is expressed in kilograms per meter squared, and it provides a rough estimation of the body's mass status of the individual in relation to his or her height. So basically, BMI helps us to estimate the body mass status of an individual in relation to their height. Okay, so that is BMI, and we are having some of the BMI ranges and comorbidity risks according to the World Health Organization and the International Obese Task Force. So these ranges are according to World Health Organization and the International Obesity Task Force. So let us go through them. Anthropometry, quantifying obesity with body mass index, that is weight or height in meters squared. Okay, so if you calculate someone's BMI, and it is, so this first column is for BMI, and then the next column is for classification, and our last column is talking about the risks of obesity comorbidity. So if at all you calculate someone's BMI and it is between 18.5 to 24.9, the classification is a normal range. So if a person's BMI is between that range, it is a normal range, and the risk for obesity comorbidity is negligible. Okay, but if you calculate someone's BMI and it falls in a range of 25.0 to 29.9, the classification is overweight. That person is having an overweight, and the risk of obesity comorbidity is mildly increased. So that person is having a mild risk of obesity comorbidity. If at all their range is within between 25 to 29.9, and their classification is an overweight. Then if at all someone's BMI is greater than 30 kilograms per meter squared, that person is obese, is obviously obese. Though still, for obesity, it has classes. It has class 1, class 2, and class 3. So if any person is having a BMI about 30, that person is obese. But still, for under obesity, we have classes. So if a person is between 30.0 to 34.9, that person is having class 1 classification of obesity, and that is a moderate one. But if someone is between 35.0 to 39.9, that person is in class 2 obesity, and that is a severe form. Okay, it is a severe form of obesity. Then if a person is having a BMI greater than 40.0, that person is in class 3, which is a very severe class of obesity. So those are the ranges according to WHO and International Obesity Task Force. So we are going to look at the next parameter, which is the height to, this is the height to hip circumference ratio. Okay. So for the height, for the waist to hip circumference, it is an indicator of the pattern of distribution of the subcutaneous and the adipose tissue. It is an indicator of the pattern of distribution of the subcutaneous adipose tissue. And distribution of fat is an important indicator of certain health conditions. For example, the coronary heart conditions. We also have diabetes and others. So that fat distribution is very crucial to diagnose someone's risk to development of such conditions. So more fat in the abdominal area increases the risk of CHD, that is the coronary heart disease. So if at all you find out that someone is, or you measure and you assess and you find out that someone is having more fat in the abdominal area by taking their waist circumference, that indicates that they are at a high risk of developing the coronary heart diseases and also other health conditions. For example, diabetes too. Okay. So that is why we are also interested in taking the waist to hip ratio. Okay. So men generally have a higher ratio than women. So they are telling us that men generally have a higher ratio. Which ratio are we talking about? The waist to hip ratio, circumference ratio, than women, and we are going to see why. Someone can even brainstorm and start thinking of why. Remember, for us to get this waist to hip circumference ratio, we are going to take the circumference of the waist and then the circumference of the hip region. So we are going to take, we shall get that value of the waist and we divide it by the value of the hip. That is why it is called the waist to hip, waist over hip ratio. So what we get is that ratio we are talking about. So they are saying that women with a ratio of 0.85 to 1.7 are at a higher risk of developing the other health conditions we've talked about, the coronary heart diseases and the diabetes. Okay. Then women who are having less than 0.85, those ones are at a low risk. Then for men who are having between 0.95 to 1.9, they are also at a higher risk of developing those health conditions. But those ones who are having less than 0.95, they are at a low risk of developing those conditions. Okay. So I wanted to tell you to talk about the reason why men generally have a higher ratio than women. Remember, anatomically in structure, ladies have more adipose tissue in the hips. That's why you see ladies having bigger hips. Let me call it hips. Their adipose tissue is higher than that one for males or for men. So if at all, for example, you've taken someone's waist circumference and it is 32 centimeters or inches, and then you take let me start with a lady having a waist circumference of 32, then the hip circumference of say 40. When you get their waist to hip ratio, it will be 0.8. Okay. But remember, for men, for them, they don't have much fat in their hips. So if you're to take their waist circumference, and for example you find that it is still 32, say it is 32 still, but their hip circumference can never be equivalent to that one of a female. For example, I've taken, for a female, I gave her 40. So now for a male, it has to be less. So say they have a hip circumference of 34. When you take that ratio, 32 by 34, you'll find that for them, they'll have 0.9. Okay? So making them having a higher ratio, waist hip ratio, than the ladies. So the bigger the hip circumference, the smaller the ratio. Okay, but the smaller the hip circumference, the higher the ratio. So that is the reason as why men have a higher ratio than women. Okay, so now we are going to look at the measurement technique of hip and waist circumference. So we are going to start with the waist circumference. So if you're to take waist circumference of someone, a good quality non-stretchable measuring tape should be used. That's why you saw that in our requirements, we prepared a measuring tape. So these are some of the indications of this measuring tape: measurement of waist and hip circumference. But that measuring tape should be non-stretchable. Remember, I want to get the actual circumference of an individual's waist circumference or hip circumference. So you should be using a non-stretchable measuring tape. Then view the patient from the front. So your subject, you have to be in front of your subject or your client as you're measuring their waist circumference. Then you locate the narrowest point between the ribs and the iliac crest. Okay, so the point at which you take the waist circumference should be that point, the narrowest point between the ribs and the iliac crests. The iliac crests are on the pelvic bones. Okay, so for example, these clients, say ribs were around here. So this health worker selected the narrowest point between the ribs and the iliac crests, the top of those pelvic bones. So after locating that point, you have to ensure that the tape measure is at the same height around the waist. Make sure that your tape measure is at the same height. Okay, because if it is not at the same height, it is going to give you faulty readings. So it should be at the same height or around the waist. Then measure and set the measurement correctly to the nearest centimeter. So after locating the point, that narrowest point between the ribs and the iliac crests, you make sure that you roll that tape measure all around someone's waist at the same height. It has to be even at the same height. Then you can now take someone's waist circumference. You read to the nearest centimeters. Okay, so next we are going to look at hip circumference. Okay, so for hip circumference, you have to make sure that you also view the patient from the front. You're supposed to still stand in front of the patient or in front of your client as you're taking their hip circumference too. But for hip circumference, you're going to locate the greater trochanters. So you locate the greater trochanters are also at the pelvic, at the pelvic bones. So probably you can revise your anatomy for these bones. But as you're taking someone's hip circumference, it has to be taken at the greater trochanter. So hip measurement is taken at the widest lateral extension of the hips. You locate the widest extension of the hips. It is where you place your tape measure, okay? Then you measure and set the measurement correctly to the nearest centimeter. So after taking your waist circumference and the height circumference of your client, next you're going to calculate your waist hip ratio, and you calculate it to the 2 decimal places. Okay, you record it to 2 decimal places. For example, 0.8 maybe 80 or 85. Okay, hopefully we are moving together. I'm not leaving anyone behind. Hope I'm not so speedy, because I want us to understand this concept so well. We started by looking at how we take someone's weight. Then we looked at how we take someone's height. Then we looked at how we can calculate the BMI from the weight and height. So next we are looking at the waist hip ratio. So we have seen how we can take someone's waist circumference, and we have also seen how we can take someone's hip circumference. So after still getting those two values, we are now going to calculate the waist hip ratio. And we say that this ratio is gotten by dividing the waist circumference over the hip circumference. Okay, so that is how we can get that ratio. And we saw that men always have a higher ratio, a higher waist to hip ratio than women. And we saw the reason as to why. Reason being, anatomically, ladies have larger hips or much adipose fat in their hips than women. And the greater the hip circumference, the smaller the ratio, and vice versa. So a hint, we are having a hint here that we measure waist circumference at the narrowest point, the point we saw, narrowest point of the ribs and the iliac crest. Then for the hips, we measure hips at the widest point. So for the waist, we measure at the narrowest point, but for the hips, we measure at the widest point of the hips. Yes, so next we have measures of body compositions. So body compositions here, we are saying that weight loss does not provide the nutritionist with an indication of the type of tissue loss. That is to say, weight loss due to loss of adipose tissue or loss of muscle tissue. But measurements of the skin folds, the mid-upper arm circumference, the mid-arm muscle circumference, for them they provide a more comprehensive picture of the body's composition or changes. So that's why we are so much interested in them, okay? That is the mark, the skin folds, because for them they bring out the actual picture of the body's composition. So next we are going to look at how we take our mid-upper arm circumference, mid-arm circumference. Okay, so the technique we follow is, one, we first locate the midpoint of the arm. And how do we locate the midpoint of the arm? We use the non-dominant hand. When we are measuring the mid-upper arm circumference, we use the non-dominant hand of a patient or of a child. Why? Why are we not using the dominant hand? The dominant hand is the hand you use mostly. And that hand you use more its muscles develop or generate rapidly. But the non-dominant hand, for it grows normally. Its muscles grow normally because it is not so much used. But for the dominant hand, it is the opposite. So that is why we decide to use the non-dominant hand, because it can show us the actual measurements that we need. So we use the non-dominant hand, and the non-dominant arm elbow is flexed at 90 degrees with the palm facing upwards. The first thing we do is to position this arm that we are going to use. And how do we position it? We position it in an angle of 90 degrees with the palm facing upwards. Then we measure, the measurer or a person taking this mid-upper arm circumference is supposed to stand behind or beside the subject, and he locates the lateral tip of the acromion process from your anatomy. The acromion process of the scapula is up here. So you locate that point. It is where you place your tape measure, your mark tape. Then you place there your mark tape and you make it run up to the elbow level. So they are saying that you place the tape measure so that it passes between these two landmarks and mark at the midpoint. So you place the tape measure from the acromion process to the elbow. Then you measure this length, and then you find the midpoint. From this length, you find the midpoint, this dot here. So that is the mid-upper arm. So it is where you're going to get your circumference, the arm circumference from. So after measuring that mid-upper arm, so next you're going to measure the mid-arm circumference. From that point you have marked the point that makes the middle of these two landmarks. Okay? So next, the subject stands erect with the arms hanging freely at the sides and the palms facing the thigh. So you're going to reposition this arm. So for taking the mid-upper arm point, it will be at an angle 90, palm facing upwards. But for taking the arm circumference, that mid-arm circumference, you will reposition the arm and make it face downwards. You make it hang freely and face downwards. Then you can now take the mid-arm circumference. So from there, you place your tape measure perpendicular to that long axis of the arm at that marked midpoint, the point you first marked. And then you measure the arm circumference to the nearest millimeters or to the nearest centimeters. Lastly, provide the actual mark in centimeters. So that is how we take. But for a baby, for example, for a baby, you might not make them stand erect for you to take the arm circumference. You can just reposition the arm from the right, from the other position where it was at a right angle, and you make it just hang freely with the palm facing downwards. So next we are going to look at child anthropometry, or these measurements in children. So basic measurements in children include weight, height, and also the head circumference, as we shall see. So for the weight, clothing to be removed. If you're to take the weight of a child, you have to make sure that you remove all the clothing. Then baby is weighed on a clean calibrated scale, and that is their pan I was talking about, the baby weighing pan. So it should be clean. Then the measurement is taken to the nearest 2 decimal places for accuracy in kilograms. So for babies, as we are taking their weight, you have to first undress them. But before you even undress them, you have to endeavor you have to endeavor closing all the adjacent windows. Make sure that the room is warm because you're going to expose the body of the baby, okay? And they have a large surface area to heat loss. So you have to make sure that the windows are closed, the room is warm, and then you undress the baby and you start weighing. And before weighing, you're supposed to first make sure that the pan is very clean, and then you put at least a sheet on which you will place the baby on as you're measuring. But before putting the baby, after calibrating the machine to 0, you put a sheet, then you first weigh the weight of that sheet. Then after weighing the weight of that sheet, then you can now put the baby, then you get the total weight of the sheet and the baby, and then you subtract the weight of the sheet in order for you to get the actual or the accurate weight of your baby alone. Then for height we use Anthropometry, and the baby is placed spine I mean lying on their back with the head against the appropriate surface, as you can see in this illustration here. Yes, and then the baby is held in a fully extended position with the heels at 90-degree position. The heels have to be at 90 degrees position, that is touching this adjustable board, and the feet facing upwards. That is the 90 degree they are talking about. Then from there you can measure. The measurement is taken to the nearest 0.1 centimeters. Then the other measurement, we have the head circumference, and the head circumference we take is the occipitofrontal circumference. I believe you know where the occiput is found. The occiput is behind that behind part of the head, and then the frontal part is this part in front. So we take the occipitofrontal circumference. So the occipitofrontal circumference of the baby is measured to the nearest 0.1 centimeters with the firm tape measure placed appropriately. So still we use a tape measure to take this circumference of the head, but it shouldn't be stretchable. It should be a non-stretchable measuring tape, okay? So next we are going to look at the road to health chart, okay? So a simple, cheap, practical, and convenient method of monitoring child health. So this health chart is a simple, cheap, practical, and convenient method of monitoring the child's health. Growth monitoring is the most useful tool available in child health, as it assists with early identification of nutritional problems, diseases, and developmental problems. And the most sensitive indicator of child's growth is their weight. It is the most sensitive indicator. So we have what we call a growth monitoring chart. I try to look for a sample. So this growth monitoring chart graph records child's growth progress. This chart records the child's growth progress. How? It has the vertical axis. It has the vertical axis, and on this vertical axis here, the vertical axis is represented in kilograms on both the right and left margins of each year, starting from 0. So the vertical axis represents the kilograms or the baby's weight, and then the horizontal axis, this one here down, for it represents the age. Okay, it represents the age of the child, and it goes up to 5 years. It goes up to 5 years with a space of 1 month. It is per month. So it starts from 0, then from 0 to 1 month. So 0 is here at the start. Then from 0 to a month. Then from the interval between this first month to the second month is still 1 month. And it goes in that way. So these are the months down here. See, this one is started in November, December, January 2000. This was October 1999, November 1999, December 1999, January. But we have updated ones. Yes, so that is the child growth monitoring chart. So the references for this lesson or for this topic of anthropometry, you can visit them and read more about these measurements in details. We have the basic anthropometric measurements in adult protocols. Then we also have the WHO Global Database on Body Mass Index, the illustrated textbook of pediatrics, that is by Leza and Clayden, and also the Family Practice Manual, Bob Masha and Julia. So those are some of the references that we used. You can visit on one of them to get more details on anthropometry and anthropometric measurements. Okay, so lastly, we have an assignment here. So as you've seen that we've talked of, we have been looking at anthropometry, which is measuring human measurements. That includes the weight, the height, the circumference, waist circumference, hip circumference. We also talked of skin fold, okay, but we've not looked at it in details. So it is an assignment to all of you people in your groups, in your respective groups, wherever you are. Discuss the different skin fold measurement techniques. Remember, we've looked at all these techniques, the technique of measuring weight, height, MWAC, that is the mid-upper arm circumference, and also the waist and hip circumference, but we have not looked at the skin fold measurement techniques. So please, you do that as an assignment in your groups, okay? And this marks the end of our session, but we have this link here. I'm going to play it, and it is a link taking us to a video of these different measurements that we've been talking about. Okay. So please stay tuned and you watch this video.
Six key types of anthropometric variables collected in surveys: age, sex, height, weight, edema, and MWAC, which stands for middle upper arm circumference. Weighing. To measure the weight of a child, place the scale on a hard and flat surface if possible. For example, concrete, solid ground, wooden board, but not on the height board. Place the scale in the shade or indoors if possible. If the scale overheats and does not work properly, move it to a cooler place and wait 15 minutes before trying again. Handle the scale with care and protect it from excess humidity. Ensure that the batteries are working before going to the field and carry a spare set. There are two methods of measuring a child using an electronic scale. 1. Direct. Measure the child by themselves. Children able to stand up can be weighed by standing on the scale. 2. Indirect. Measuring the child in the arms of a mother or caregiver, also referred to as double weighing, applies for young children, children who are too weak, children who are disabled, or children who are restless and cannot stand still on their own. Direct weighing, generally for older children. 1. Explain the procedure to the mother or caregiver. 2. Remove all clothing and jewelry. 3. Wait for scale to stop at 0.0 or 0.00 depending on the scale in use. 4. Ask child to stand on scale. 5. Wait until the number stops flashing before reading the weight measurements. 6. Measurer reads the weight out loud. 7. Assistant repeats the weight out loud to confirm with the measurer and records the weight. Double weighing. Younger or sick children. 1. Explain the procedure to the mother or caregiver. 2. Take off the child's clothing and jewelry. 3. Place the scale on a flat surface. Turn on the scale. 4. Ask the mother or the assistant to stand on the scale. 5. After the weight appears, press the hold or tear button to zero the scale. 6. Once 0.0 appears, the child is given to the person standing on the weighing scale. The child must be held facing the person and should keep still. Only the person whose weight was used to zero the scale must hold the child to be weighed. 7. The weight displayed will be the child's weight. 8. The measurer reads the weight out loud. Assistant repeats the weight out loud to confirm and records the weight. Length. Measure length when the child is less than 2 years of age or less than 87 centimeters. Use one inclusion criteria, age or height, and be consistent throughout the survey. 1. Explain the procedure to the child's mother or caregiver. 2. Remove the child's shoes and any other hair ornament on the top of the child's head. Clothing does not need to be removed for this measurement. 3. Place the child gently onto the board on his or her back with the head against the fixed vertical part and the soles of the feet near the cursor or moving part. The child should lie straight in the middle of the board, arms at their side, looking directly up. 4. The assistant should hold the child's head firmly but gently against the base of board. 5. The measurer places one hand on the knees to keep the legs straight, places the child's feet flat against the cursor with the other hand, and pushes the cursor against the feet firmly but gently. 6. The measurer reads and announces the length to the nearest 0.1 centimeters. 7. The assistant repeats the measurement out loud and then records the length to the nearest 0.1 centimeters. MUAC. Mid-upper arm circumference measures the amount of soft tissue in the arm and reflects muscle density. It is often used for program monitoring and screening. Measurements are taken on the left arm and recorded to the nearest millimeter. 1. Explain the procedure to the child's mother or caregiver. 2. If possible, the child should stand straight and sideways to the measurer. 3. Bend the left arm at 90 degrees to the body. Place the MUAC tape along the upper arm and find the midpoint of the upper arm. The midpoint is between the tip of the shoulder and the elbow. 5. Mark the mid-upper arm point with a pen. 6. Let the left arm hang relaxed at the side of the body. 7. Wrap the MUAC tape around the midpoint. 8. Pull the tape until it fits securely around the arm. The tape should not be left too slack or pulled too tightly. The tape should touch the skin all the way around the arm but not make a dent in the skin. 9. At the MUAC reading window, the measurer reads and announces the MUAC measurements to the nearest millimeter. 10. The assistant repeats the measurement out loud and then records to the nearest millimeter. Introduction and age. By taking anthropometric measurements of children between 6 and 59 months, we can effectively measure the nutritional status and risk of mortality within a target population. This video will help to demonstrate how to take anthropometric measurements of children aged between 6 and 59 months and how to create an events calendar to estimate a child's age. In order to ensure good quality surveys, much attention should be paid to the daily calibration of the measuring equipment as well as anthropometric measurement techniques. We can determine the nutritional status of a population by measuring weight for height, weight for age, and height for age. Height for age and weight for age are more difficult to take accurately because age is not reliably reported in many populations, especially where birth recording is insufficient. To help us determine age, we will create an event calendar which is covered later in the video. To determine
Yes, so simply that is what I wanted you to see in that video, how we take weight, how we take height, and it has really brought it out so well, though it was basically looking at how we take the anthropometric measures on children, which is also very good. So in our practical session, our online practical session, we are going to be looking at how we take weight and height of an adult. So stay tuned and let's meet in our practical session. Thank you so much for this session, and this marks the end of our lesson. Thank you so much for listening. We meet in the next session.